Assalamualaikum and hi everyone. So now I'll be explaining my part, which is about the synthesis and metabolism of acetylcholine or ACH. So first, what is acetylcholine? Acetylcholine is one of the most important neurotransmitter in our body. It helps transmit signals in both of the nervous system, which is central nervous system like the brain and spinal cord, and the peripheral nervous system, especially in muscle and glands. It plays a role in learning, memory, attention, and muscle control. Moving on to the next part, which is the synthesis of acetylcholine, or how is ACH made. ACH is synthesized inside the nerve terminal, and the process involves two main raw materials, which is choline, a nutrient that comes from our diet, and acetyl-CoA, a molecule made inside our cells, especially in the mitochondria. These two substances are combined through the help of an enzyme called choline acetyltransferase, or CHAT. So the reaction is choline plus acetyl-CoA by enzyme choline acetyltransferase. It becomes acetylcholine, ACH. So this process happens in the cytoplasm of the presynaptic neuron. Once ACH is made, it doesn't just spread around, it's actively transported into synaptic vesicles by a special transporter called VACHT, which is vesicular acetylcholine transporter. These vesicles store ACH safely until it's time to be released. Next is the release of acetylcholine. When a nerve impulse reaches the end of the neuron, it triggers exocytosis, the vesicle fuse with the membrane, and release ACH into the synaptic cleft, which is the small gap between two neurons. And the fourth one is metabolism of acetylcholine, or what happened next. Once ACH is released and bind to the receptors on the postsynaptic cells, like a muscle or another nerve, it performs its functions, like activating a muscle or passing on a nerve signal. But we don't want ACH to stay there forever. Too much stimulation can be dangerous. So, ACH is quickly broken down by an enzyme called acetylcholinesterase. These enzymes will break ACH into two parts, which is choline and acetate. Choline is recycled and taken back into the presynaptic neuron to be reused to make more ACH. So, to make it short, ACH is made from choline and acetyl-CoA. It is then stored in vesicles and released when needed. After it acts on the target, it is broken down by acetylcholinesterase, and the choline is reused again. This cycle is super important for proper nerve and muscle function, and also explain why drugs that interfere with this process can have serious effects.
Assalamualaikum warahmatullahi wabarakatuh. My name is Syaira Afika binti Subri. So let's we move to the mechanism of drug action for cholinergic drugs. Before we starting the drugs interaction with the neurotransmitter and the specific drugs, let's we discuss about parasympathetic effects. The parasympathetic nervous system uses acetylcholine to produce its effect by acting on muscarinic receptors in target organs like eyes, lungs, heart, blood vessel, GI tract, bladder and salivary glands. So the drugs that affect the acetylcholine or muscarinic receptors can either mimic parasympathetic effects, which is agonist, or block parasympathetic effects, which is antagonist. How drugs interact with neurotransmitters. Firstly, we have direct-acting cholinergic drugs, which is agonist. The mechanism involved is mimic the acetylcholine and bind directly to cholinergic receptors, which is muscarinic or nicotinic. It stimulates the receptors to produce a parasympathetic effect. As we can see the diagram beside it, the drug bind directly to the cholinergic receptors. For example, betanicol, it binds to muscarinic receptors in the bladders to stimulate urination. Other than that, pilocarpine stimulates the muscarinic receptors in the eye to increase the fluid drainage. Then, indirect acting cholinergic drugs, it inhibits the ACHE, which is the enzyme that breaks down acetylcholine into acetyl and choline. So it can increase the acetylcholine levels in the synaptic cleft and can cause the prolonged stimulation of cholinergic receptors. As we can see in the image, the drugs bind to the ACHE and it inhibits the breakdown of the acetylcholine. For example, danpezil, it is used in Alzheimer's disease to improve memory. Lastly, cholinergic antagonists, which is the blockers. It can block acetylcholine from binding to its receptor, as we can see in the image, and it prevents the cholinergic activities, mostly parasympathetic effects. It has two types, which is muscarinic antagonist and nicotinic antagonist. For muscarinic antagonist, it blocks the muscarinic receptors. For example, atropine, it can increase heart rate, and ipratropium, it can be bronchodilator, basically for the asthma or COPD. Then for the nicotinic antagonist, it is the neurotransmitter blockers, example rocuronium, and it can be used in the anesthesia. This is the example of specific cholinergic drugs. It has the muscarinic agonist, ACHE inhibitor, muscarinic antagonist, and nicotinic antagonist. For the muscarinic agonist, we have betanicol and pilocarpine. As we discussed just now, betanicol is to stimulate muscarinic receptors in bladder or GI tract. Pilocarpine is to stimulate salivary and ocular secretions. For ACHE inhibitor, it has neostigmine and danpezil. Neostigmine is to inhibit ACHE, and it can cause the increases acetylcholine in the synaptic cleft. For the danpezil, it increases the acetylcholine in brain. For the muscarinic antagonist, we have atropine and ipratropium. Atropine can block the parasympathetic effects, and ipratropium can be bronchodilator via airway smooth muscle relaxation. Lastly, nicotinic antagonist, we have rocuronium. It can block nicotinic muscular receptors by muscle relaxation or paralysis.
So next, I will be discussing the clinical applications of cholinergic and related drugs. On this slide, you can see a table listing some important drugs, their conditions, and their effects. So the first drug is betanicol, which is used for urinary retentions because it stimulates bladder contraction to help patients urinate more easily. And secondly is pilocarpine, which is used for glaucoma and dry mouth because it increases fluid drainage in the eye and promotes salivations. And thirdly, we have neostigmine, which is used for myasthenia gravis, which is a condition that causes muscle weakness because it enhances neuromuscular transmission, which help improve muscle strength. And number 4, we have donepezil, which is used for Alzheimer's disease because it improves cognitive function by increasing acetylcholine in the brain. And number 5, we have atropine, which used in cases like bradycardia or acetylcholine poisoning because it raises the heart rate and blocks the effects of excess acetylcholine. And number 6, we have ipratropium, which is used for COPD and asthma because it relieves the bronchospasm and helps the patient to breathe more easily. And lastly is rocuronium, which is used in surgery for muscle relaxation, particularly during intubations. So these drugs have a diverse applications and play critical role in treating various conditions. Okay, next let's talk about dosing. So usually the dosing is tailored to the patient's condition, age, and kidney or liver function. So this is some of the example of typical dosing for these example drugs. So firstly, which is betanicol, is typically given orally at 10 to 50 milligram 3 to 4 times a day, and pilocarpine, which is administered as eye drops 1 to 2% solution up to 4 times a day or orally at 5 milligram 3 times a day. And thirdly is neostigmine, which typically taken orally at 15 to 375 milligram per day, but this dose is divided into smaller doses throughout the day. This is because neostigmine has a short duration of action, so dividing the dose helps maintain a steady effect, especially important for conditions like myasthenia gravis, where continuous muscle strength is needed. And for urgent cases, neostigmine can also be given by IV at zero point 0.5 to 2.5 milligrams. And next is donepezil, which usually taken as a single oral doses of zero point 0.5 to 1 milligram every few minutes as needed. And lastly is ipratropium, which is by inhaled, usually 2 puffs 4 times a day. So accurate dosing ensures that these medications are both safe and effective for patients. And lastly, let's discuss the benefits and therapeutic uses of these drugs. So firstly, they help restore normal functions such as urination, breathing, and cognition, which improve the quality of life for patients. And second, they aid in medical procedure such as muscle relaxation during the surgery. And they also manage parasympathetic overactivity such as in bradycardia by balancing the acetylcholine activity. So, in summary, cholinergic drugs are essential in both everyday clinical care and emergency situation that because it offers significant therapeutic benefits.
Let's explore cholinergic drug side effects and how they interact with other medications and body system. Side effects depend on the drug type. Muscarinic agonists may cause sweating, nausea, and also abdominal cramps. Meanwhile, antimuscarinics may lead to dry mouth and also constipation. Cholinergic drugs can interact with many medications. Beta blockers may increase bradycardia when combined with cholinergic agonists. Antihistamines, antipsychotics, and tricyclic antidepressants can enhance the anticholinergic side effects. And lastly, cholinesterase inhibitors may reverse the effect of neuromuscular blockers like pancuronium.